So last but not least, we have our friend Tim Ringrose from doctors.net.uk, but now you're called M3 as they've merged with this. So Tim used to work in the NHS before joining this platform, and doctors.net.uk, you were telling me, is, gosh, 16 years old now?
Yep, 1998.
16 years old. I mean, that's shocking and fantastic. But so this is, you know, one of the largest physician networks and online communities of doctors before there were even online communities. But what has evolved to today that we're going to see from Tim is this idea that physicians connecting among themselves is one thing, but it's a challenge for organizations who want to communicate information to physicians, be they the pharmaceutical industry, charities, you know, hospitals. So what is a meaningful way to engage with physicians if you're not part of the physician community? And this is a solution that Tim has developed and would like to show us today.
Thanks, Andrew. Could we switch the screen to this laptop? So the fact that doctors are using the internet to source information is not new. Doctors.net UK is not new. And the fact that doctors are using online networks to talk and share is not new either. But sometimes organizations who want to engage doctors find that quite difficult. And if you look at the way that organizations communicate with doctors, it's often not very conversational. And that's why we introduced this service. So what I'm going to show you is not as high-tech as some of the things you've seen today, but hopefully I can persuade you it's been quite effective so far. So this is Doctors.net UK. As you can see, there are 209,000 doctors using it, and about a quarter will log on a day like today. So I will just log in. The network's a bit slow, I think. Here we go. Every member joins and creates a profile, and so when they use the service, the pages are built according to their profile. So the profile that I'm showing you is mine, and I'm pretending to be a GP today. And you'll see when the content loads that I'll be shown a range of different services relevant to me, my med school, where I work, my role as a GP. But I want you to look at the section on the right, the portlet that's loading there. This is the new service that we've launched called Messages, and it's designed for third parties, whether it's commercial organizations or the employers or for charities or societies who want to engage with doctors to be able to do that in a personalized and meaningful way. So I'm going to draw your attention to the message at the top, which is about spotting the signs of cancer. So I'm continuing the cancer theme. So if I click on that, this is an invitation which I don't have to accept. So I'm going to look at the invitation and decide if I want to receive this kind of message. It's a bit like LinkedIn. So I can see it's from a doctor, so it's personalized. I can see it's relevant to me as a GP, and I can see it's about early diagnosis of cancer. So this is a program that's been commissioned by Cancer Research UK, a charity, and what they're trying to do is to ensure that doctors don't miss very important but often overlooked signs of cancer. So I'm going to accept that message. And I've got some member credits. So this is a non-financial scheme. It wouldn't be compliant if it had any points attached to it, but it gives me some benefits in terms of functionality on the website. And I've got the first message loaded up here, and it's asking me, do I think that chest pain alone is more predictive of lung cancer than a cough alone? Now, everybody knows that unexplained cough for several weeks is a risk factor for lung cancer. But when we did some research, we found that less than 50% of GPs realize that unexplained chest pain is actually a higher predictive value for lung cancer. So I'm going to click false because that's what most GPs said in our survey. Submit my answer, and I find out that, in fact, I'm wrong. So this is an important way to be able to engage doctors with information that they didn't know. These are the Donald Rumsfeld, the unknown unknowns. So I get an explanation. That's one message, and I'll now receive more messages which I can then click on. But I'm not going to show you those because we're running out of time. But what I do want to show you in the last few seconds is you're probably sitting there thinking, this looks good, nice messaging system, nothing too innovative about that, but can you show it's effective? Well, we did some research with 30 of the GPs, and we've had thousands of them engaging this so far, to look at the impact of this program. And the great news was that we found that half of the GPs who looked at it could recall all of the 4 messages about different cancers: lung, colorectal, prostate, and breast. Importantly, this issue about chest pain, 97% of them could recall that important message, and 77% said that this was going to change the way they treated their patients, and you can see some verbatims on the right. Thanks.
Thank you. Okay. So I just wanted to get a perspective from Gabor here on this platform. You know, we've talked a lot about how we engage different stakeholders and how physicians need some way in which to sort of process all of this information and learn in a meaningful way. So just wanted to get your thoughts on what you saw.
Yeah, I love this because this is exactly what I was talking about. So all the content is based on the profile and the previous behavior of the physician, so on listening to the physician. It looks great, but I'm really, really curious, Tim, that could you share with us what are the key points of a successful messaging program? Because I'm sure it's not so simple and easy that it looks like at the first.
Yeah, that's a good point, Gabor. And if you look at a lot of the messages that are sent out to doctors or other healthcare professionals, they're often overly long. They're often sometimes a bit patronizing. So when we talk to GPs, they said, well, what pharma does is they get KOLs to produce a leaflet to tell us that we're rubbish. And so that's not very engaging, and they're not very personalized. And so I think the 3 things that we'd recommend are they're short, they're very relevant and targeted, and that they're personalized. So we really recommend that you attach an identity with each message so that you build some rapport. Because it wouldn't be great if that doctor bumped into that doctor in a meeting and said, oh yeah, thanks for the messages, that's been really useful. So you can then connect real life to online.
Yeah, and just in closing, I was going to ask you a question of, you know, he just mentioned pharma. You know, as a pharma company trying to meaningfully engage with physicians, it seems to me that something like this would kind of raise the bar in terms of the level of conversation, because the physician can kind of select which messages to listen to and which to ignore. So maybe there would be sort of a built-in learning in the system so that messages do become better and more personalized. So I was just wondering if this is something, or if you're thinking of similar things in your role at Sanofi.
Yes, this is a big, good question. Our feeling is why we need to have the conversations on our platforms. The best conversations is on the physicians' platforms on communities. Then what we need to do as a pharma industry is to bring our discussions, our challenge where the physicians are. This is a big challenge, and we need to move to this fashionable movement. But for me, I would like to finish with another question: is the digital opinion leaders are the person who can influence on the rest of the physicians, or the key opinion leaders, the offline key opinion leaders, continue being the leaders of the opinions of what we need to prescribe? We are working strongly on digital opinion leaders, on the targeting of, in each specialty, who is the influence on the digital channels. But what happened with the key opinion leaders that continue going to the Congress to say that this is the real decisions that you need to take? What we need to do is to take the digital opinion leaders to the offline world, or we need to take the key opinion leaders to the digital world?
Yeah, exactly. I think that's right. There's sometimes a big difference between the traditional KOL and the digital KOL, but particularly for digital KOLs, their natural world is the online environment, so why not engage them in that? And so listening to Daniel earlier on talking about their services, that's a perfect match for this kind of service where the doctor's hearing from someone they trust. But it need not necessarily be a KOL, it could be a brand manager. Why not?
Yeah.
All right, you guys can talk after the panel. All right, well, with that, I know that we're slightly over time, but I would like to ask you to give the panelists a hand for a wonderful panel. And